Hey people, it's Niya's story. This is a story I wanted to talk about for a long time, but it kept getting forgotten about. So this is from Daily Mail. Black medical student creates a handbook to show how symptoms of disease appear on darker skin after he was only taught how to diagnose conditions on white patients. A black medical student has created a handbook for future doctors to help them recognize conditions on darker skin after only being taught how to diagnose white patients. Malone Mukwende, a second-year student at St. George's, University of London, wrote Mind the Gap to help other medics recognize potentially life-threatening diseases on black and minority ethnic people. The book contains side-by-side images showing how illnesses appear on light and dark skin, as well as telling doctors language which is appropriate to use with patients. Speaking to the British Medical Journal, Dr. Mukwende said, "On arrival at medical school, I noticed a lack of teaching about darker skin. We were often taught to look for symptoms such as rashes in a way that I knew wouldn't appear on my own skin." He said and added a statement, "The book addresses many issues that have been further exacerbated during the COVID-19 pandemic, such as families being asked if potential COVID patients are pale or if their lips turn blue. These are not useful descriptors for a black patient. As a result, their care is compromised from the first point of contact. It's essential we begin to educate others so they are aware of such differences and the power of the clinical language we currently use." St. George has backed the project and even partnered Mr. Mukwende with a team of lecturers to help him publish the book. The team includes Margaret Turner. St. George's has backed the project, teaming the pioneering student with lecturer in diversity and medical education, and Peter Tomoni, a clinical lecturer in clinical skills. A university spokesperson said it was agreed that this was a very important issue and an essential part of decolonizing the curriculum. Mr. Mukwende's handbook, which will be released in the coming months, comes after more than 186,000 people signed a petition urging British medical schools to include BAME representation in clinical teaching. They point to Kawasaki disease, a rare condition that mainly affects children under the age of 5. Around 8 in every 100,000 children develop Kawasaki disease in the UK each year, and if untreated, complications can be fatal in about 2 to 3% of cases. Its characteristic symptoms include a rash, swollen glands, dry or cracked lips, red fingers or toes, and red eyes. On white skin, this appears as a red blotchy rash, but it's much harder to spot on darker skin. Well, I hope you've enjoyed that. This is very important because, as with medical apartheid, a lot of medicine is built off of the experiments that have been taken part on black people, but there is very little work put in to help meet the unique needs of black patients. So I applaud this young man, and let's hope we see more of it. I'm going to leave this article and maybe some more in the description. Please comment, rate, share, and subscribe. If you'd like to support this channel, leave my GoFundMe in the description. If you'd like to follow me on Instagram, I'll leave it there as well. Peace.